So on September, I believe the 18th, the Carter County, Tennessee Commission voted unanimously to write a draft of concerns about Ballad Health. Now, this is going to go to the state and hopefully convince the state legislature what a mistake it was to allow this merger to happen. Several people spoke at the commission meeting about their concerns. Some of them were previous nurses who've worked there, talked about the level of care. Now, don't get me wrong, that has nothing to do with the nurses or the staff. It has to do with the management and what they, basically the supplies they have, the staff they have, how the management has let the staff down. So what gets me the most about this is, let me give you Ballad's response here. Basically, when they heard the Carter County Commission, which is, by the way, the only county commission so far that has been bold enough to take a stand against Ballad. Even one commissioner during the meeting said, they're vindictive enough, they'll probably close our hospital because we did this. They're a healthcare system. They're not the mafia, but they are run like the mafia. I'm not saying they're a crime syndicate. Not saying that, just so your attorneys hear that, Mr. Levine. But you strike fear in people, and that's how you manage. You manage by fear. And you manage very poorly, by the way. So let me read you Ballad's response here. Ballad officials, when contacted for comment by Johnson City Press, said that the hospital closures continue in 150 communities across America, including Tennessee, have lost their hospitals. Now, so basically, that's a veiled threat right there that Ballad's saying, well, you could lose your hospital. Well, let me ask you, Mr. Levine, how many of those hospitals that were lost had a certificate of public advantage, and the reason you were able to exist is because of that certificate of public advantage? Chances are the ones that closed weren't given the special treatment you've been given by the state. So that's a line that nobody buys, okay? And he goes on to say the reason the hospitals haven't closed is this hasn't happened here because Ballad is taking the right steps, and these decisions are made with approval of the state. Well, let me tell you about the approval of the state. I went through all the COPA requests. The state has not denied one single request from Ballad. They've approved everything they've asked for, every time. Whether they want to do away with the certificate of needs during COVID, whether they want to make that permanent, even though initially Ballad could not find a certificate of need from another facility. But now they've gone back to the state, and the state said, oh, yeah, we'll let you be in the process and deny other certificate of needs for other people, other healthcare facilities. That has become permanent now because the state allowed it. So anyway, despite worst hospital staffing shortages in American history, Sycamore Shoals Hospital has remained open, including emergency care, surgical service, expanded access to psychiatric care in Carter County. Well, yes, it has. The staffing shortages, by the way, are not because, let me tell you, people are moving here in droves because this is a great place to live. What they're realizing is our healthcare has gone to pot, and I'm going to use that word, because of you, Levine and Ballad. People don't want to work there. There's plenty of people locally who can work at hospitals, are qualified or licensed and can do it, but they don't want to work for Levine. They don't want to work for Ballad. They've ruined it. But this is my favorite. Unfounded statements. Again, this is Ballad's response. Unfounded statements to the contrary about what a great job Ballad is doing, or failure to acknowledge the material challenges hospitals everywhere are facing do a disservice to the community and to the team members who show up every day to care for their neighbors. Who does a disservice to the team members, Mr. Levine? This is what you said back when you were going to close the ICU. Levine says clinical quality, pay special attention. Alan Levine says clinical quality and finances both point toward the closure. of Sycamore Shoals. Clinical quality. So in other words, you don't have faith in your staff, right? That's why you closed it. That's not really why you closed it. You closed it because you want to pad up the medical center, right? For some reason, you want to shift everything over there to an already overcrowded, understaffed hospital. Let's take a look here at what the state said. This is a letter from the state, of course, approving that the ICU and the PCU be closed. I don't want to go on and on about this, but this is a bunch of, stuff. It goes on, the paragraph reads here that the ICU and PCU services will remain available to patients and citizens formerly received service at Sycamore Shoals. Now you can go some 9 miles away to the medical center. Again, overcrowded, understaffed. Well, what about Mountain City? You've cut that hospital down to nothing. It's a lot farther than 9 miles from Mountain City, but I guess you forgot about them, right? Yeah, who cares? You're living in your $1.3 million house, right, Alan? Yeah, you don't care about us. So it goes on to state, though, here, that the Johnson City Medical Center will be able to staff and increase the ICU and PCU census, and to do so more efficient in the use of limited staffing resources. Well, nobody wants to work at the medical center. We know that. But this is what gets me the most, and this is why this whole deal stinks. The state says the consolidation letter also assures, now this is the letter from Ballad, assures us, the state, that the proposed consolidation will not disrupt any other services currently provided at Sycamore Shoals Hospital. Absolute a crock of, Here's why. There are physicians already at Sycamore Shoals who cannot do surgery there on some of their patients because they don't have an ICU and a PCU. Sometimes post-op care is needed beyond just a regular floor bed. It's needed in a unit, an ICU unit, where a ventilator, there's not any ventilators there now, okay? Other than maybe the emergency room may have some, I'm sure, but you can't transfer a surgical patient to the emergency room, keep them on the ventilator. So let me explain to you real quick what they're doing here. Ballad and Mr. Levine have created a problem by getting rid of the ICU and the PCU. The problem is surgical patients who need ventilation long-term, which means, overnight, post-op, now have to go to the medical center, even for surgery. But the problem they've created is just that. So what's going to happen is they've already created a solution before creating the problem. They've created this problem of no ventilation post-op, so they'll have an excuse to close surgery. That's exactly right, Levine. We know what you're doing. I know you think we're a bunch of stupid hillbillies, but you're the arrogant prick that makes $4 million a year, lives in a $1.3 million house, and don't care about us. More to come.